Good afternoon. Thanks for inviting me here. It's really exciting to have so many people in the BU community together. So this is just a lovely event, and it's great that you guys do this. So my name is Lisa Allee. I am a assistant professor in the Department of Surgery. I am not going to start this without giving kind of full recognition to Annie Buck, who is in the audience, who is a PhD candidate at the School of Public Health and Health Service Policy Research. She is also a research collaborator with our Social Responsible Surgery Group and an advocacy lead. And this is really her brainchild, and she's the one who wants us to move this forward. So it's really exciting work. So first, just what is an ERPO? And it's interesting as we start to ask clinicians if they even know what this is, how many people are totally unaware that we have an ERPO law in the state of Massachusetts. So this is something that, as you see here, our law passed in 2018, and there's still just a huge deficit in overall knowledge, hence why we're doing this. There are 21 states who have ERPO laws in our country. There are many others starting to develop them, including New Hampshire and Maine, who are local, which is very important to us as well. And when you think about ERPO laws and why they were developed, right, it's really that background of mass shootings. Everyone after mass shooting says, there was something I should have known, or I should have picked up on, or there was a social media post, or somebody said something to me and I should have said something. According to Everytown's research, they say 32% of mass shootings could have been prevented because somebody posted something or said something to somebody that they were going to do this event. Right. And that's really where the background is to this and why this has been pushed forward in legislation. I am a community violence person, so I do clinical work in community violence prevention. And honestly, ERPO laws were not on my agenda either, because when we think about community violence victims, our firearms out on the street that are used in community violence are primarily just guns that are either made, the ghost guns, right? Kids are ordering parts online on Amazon and building firearms. They're guns that come over state lines. They're illegal firearms that are being sold on the street. So how is ERPO laws really relevant, right? And this is what we kind of think of. And so I've been trying to really broaden my perspective on that and think, where does this fit into not only my work, but the work we do in healthcare? And the more we think about it, ERPO laws could be relevant in community violence. We do have a lot of talks around retaliation and people who own firearms and what that could look like. But there is a lot of domestic community violence where there are escalating violence threats to loved ones with firearms, specifically with firearms. We're seeing these patients day in and day out in our ERs. We have opportunity to really get in there and do something about this. In addition to that, I don't even need to mention to this group probably that when we're doing suicide risk assessments, right, and we are talking about means matters, are we even educating people about ERPO laws? If clinicians don't know they exist, how are we moving this agenda forward? How are we really trying to get these firearms out of the homes? And so that's where this comes in. We really want to start to think about why or what clinicians know, if they would want to get involved, and why, if we passed the law in 2018, only 57 ERPOs have been issued and only 41 total weapons surrendered. So what's the data? What do we know about this, right? It seems like if this has been going on for years now, right, there's been this big push legislatively get these ERPOs out, that there'd be a lot of data behind this, but this is it. Right. So my amazing medical students were able to put every research article we could find on one slide, right? This is it. And so that's why we're really trying to get to the bulk of this. We need more evidence. We need more data to support this and move different legislation forward. So what are we going to do? So this is our goal. We really want to explore clinician filing. We want to explore, we're developing a survey where we're going to explore what do clinicians know about this law, what's their comfort level, right? One of the things we think about in terms of clinicians getting involved in legal things like filing is mandated reporter filing and how difficult that is, right? People get worried about relationships and affecting relationships with their patients and the families that they serve. Is this going to be a barrier? And what are some of the other barriers that you see up here? Once we get our data, these are some of the things we plan to do. We have been in touch with local state agencies, the Mass Medical Society, and helping us develop an educational curriculum for ERPOs. There is our current firearm comprehensive bill that's pending right now, and legislature has an amendment to the ERPO law to add clinicians in the filing. So this is kind of our push to do this, right? Clinicians and school administrators, school officials, and employers to really expand that law and take the responsibility off the family member and allow clinicians to step in and do this. And I know I'm at time. I could go on forever, so I apologize. Thank you so much.